Good morning. It's July 25th, 2023. I'm Dr. Ari Deuk, CEO and founder of the Deuk Spine Deuk Joint Institute. Our patient is here from Mississippi. She has herniated discs in her neck, degenerated discs. Folks, herniated discs become degenerated discs over time. So it's the same disease, it's just further along. She has three herniated discs. Two of them are bad, pinching the nerves that are going into her arm. She's having nerve symptoms of numbness, tingling, weakness in the left arm. It's getting worse. We saw the MRI. She had C5-C7 disc herniation with some bone spurs forming. And we talked about treatment. She did not want a fusion, which was offered to her by other surgeons, which of course we've talked about fusions. They make a lot of money for the surgeons, but they're not good for the patients. She wanted a less invasive, safer, more effective treatment that did not affect her voice or had a low complication risk. And that's what we're doing today is the Deuk laser disc repair. All right, we've given her a little more muscle relaxer, and at this point we're ready to get started. The first thing we need to do is access the two discs, 5, 6, 6, 7. You can see on the lateral view 2, 3, 4, 5, 6, 7. She does have some osteopenia. I can see her bone density is lower. We're going to give her a little gentle, I need inline track, doctor, before you guys pull. Otherwise you'll pull her whole body south.
Ready?
Okay. Hold on now, hold on. So I'm going to get my fingers in here, and I want to displace the trachea and esophagus and get into the midline shot. Is that me right there? All right. It's 2, 3, 4, 5, 6. Shot. That's good. Give me an AP quickly. Quick AP shot. Good. Not lateral. So looking good so far. Everyone doing their job.
Yep.
Here we go. Shot. All right. That's about as good as we can get it. Shot. All right, we need an AP now, quick. No, stay there. I feel like we're off to the side, but let's see. Shot. That looks pretty damn good, huh? Lateral. Actually, that's pretty good, guys. Shot. I think we're inside the disc. Let's go Coker. AP. So 2, 3, 4, 5, 6, 7, everyone agrees. 6, 7, shot. All right, so on the AP, we're off a little bit, but we are definitely into the disc already on the lateral view. So I think we're okay. You can see the trachea and esophagus displaced to the side. Show us, Jordan. The trachea, of course, has the endotracheal tube. The esophagus, of course, has the esophageal temperature probe. All right, let's go lateral. It looks good to me. Luis, what do you think? Looks good to you?
Looks good.
I mean, if we were right in the front of the disc, we'd be a little bit too far to her left, but shot, because we're already inside the disc, it's perfect. Shot. Yeah, it looks good. Looks really good. All right, so I'm going to go a little bit further. Hold on. Shot. Yeah, it's pretty collapsed disc. 2, 3, 4, 5, 6, 7. And I could feel it. Can you give me a little inline?
Sure, yep.
Just got to be careful with her. Shot, because she does have the osteoporosis, or osteopenia, I should say. Shot. All right, good. You can see the tear. Show us the tear.
Just pull a little bit. Yeah, pull a little bit loose.
We're good.
Good.
Yeah, there's the tear. You didn't do another shot, did you?
No.
Guide wire. We're going to place the guide wire. I'm going to give a little numbing medicine in the scan. Okay. Like I said, very collapsed disc. Shot. All right. Shot. There's the needle and the guide wire. Yeah, it's pretty collapsed. Shot. I could feel it. All right, incision. We're going to make our incision. $4 mm incision. That's all we do is 4 millimeters. The whole surgery is done through this tiny incision. See this, folks? Let me have a marker. Now, if we were doing a fusion on her, the incision would be literally this big from here to here, okay? And think about all the damage done under the skin, all the scar tissue. So instead, we're doing a 4 millimeter. I'm taking out this needle, leaving the guide wire. Henry, let's show the audience how is it that these herniated discs shot can cause so much neck pain. All right, we're going to need to do a pull. Shot. Perfect. Looks great.
Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain, causing localized neck pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
Okay, now you understand why disc herniations cause so much pain, or inflammation, neck pain, headaches, arm pain. Take a look at the x-ray here, Henry. You see the arrow?
Yes, we do.
Circle the middle of the spinous process. There it is. You can see the spinous process right there. We're right in the middle. So the dilator is at the front of the disc in the center of the spine. The guide wire is running off to the left side of that degenerated C5-C7. Remember, our incision was 4 millimeters. Maybe I did a little heavy-handed, 5 millimeters today. We've lost about 2 drops of blood maximum. All right, so let's show where we are. Shot. Good. Let's go ahead and I'm going to try to advance the dilator into the disc. You give me a little bit of extension. Shot. There we go. So we're starting to go into the 6-7 disc. Shot. I need my team giving me good inline traction. Shot. And the reason is, shot. That looks good. The reason is that keep going and no flexion. Seriously, like extension. Shot. Okay, we're making slow progress and that's fine. Shot. We want to get all the way to the back where the bone spurs and herniations are. Boy, she's got a seriously collapsed disc. Shot. Almost there. I need extension, yeah. Shot. That looks really good right there. All right, good job everyone. We're almost done. Not quite though, don't run away. For those of you who've never seen the Deuk laser disc repair, it's endoscopic surgery, transdiscal. Learned this part from the Koreans, Dr. Seng-Ho Lee, Dr. Gun Choi, many years ago, 16 years ago. And the part with the laser, well, that's what I brought in as a new technology, the Deuk laser disc repair, and that's why we call it the Deuk laser disc repair, because number one, it was developed at Deuk Spine Institute. Number two, we use a laser, and that's a very important part of the surgery. Number three, we're operating on the disc, so it fixes degenerated disc, herniated disc, ruptured disc, protruded disc. Shot? All right, Luis, I need you to hold both shoulders while I do this, okay?
Sir.
And then finally repair, because the idea of the surgery is to let your disc repair, not fuse, not put an artificial disc. Hey, Berndes, we need you. We, you know, don't run away. You know that, we're not done. Shot. I'm wondering why it's so difficult. Shot, there we go, and there's a little better. Give me some inline. There it goes. It's gradual, slow progress, almost done. Shot, that made some progress. Let me just loosen it a little bit. Wowza, wowza. Whew, it's a bad disc. Shot. Almost done, just another millimeter, and I'll be happy. I think that's great right there. Thank you, everybody. Good job, Dr. Berndes, Luis, Oscar. Okay, so at this point we have advanced the tube. Show the tube there, Jordan, on the x-ray. Henry, take a look at the x-ray. You see the tube? Show the end of the tube, right where it is. There it is. Okay, it's at the back of the disc, and we're going to now take out the dilator that we put the tube over. The dilator helped facilitate placement of the tube. And Luis has removed it. I would clean that out because we're going to need it for the next one for discogram.
Yes,
All right, take a shot. Here. Shot. All right, you can see the tube is at the back of the disc at 6, 7. 2, 3, 4, 5, 6, 7. Any questions from the audience so far?
No current questions, but we do have a comment from Edward on YouTube.
Hi, Edward. Thanks for joining our live stream at Deuk Spine Institute.
They said, "This isn't my family, but I hope it all works out for you guys and her."
Thank you so much. We appreciate the positive vibes. It's going to work out great for her. I know that because I've done this over 1,600 times, and it's never not worked out great from a surgery standpoint.
Can you decrease the brightness probably?
The surgery is amazing. All right.
Couple more, I think. There. Yeah.
All right, so what we're looking at here at the bottom of this tube, remember the tube ends right there. We're looking at the blue stuff is herniation, the white stuff is scar tissue, and the yellow thing right there is a bone spur. We're going to clean out all the bad stuff. Thank you. All right, here we go. Now, the blue fiber moving up and down, that's the laser. And the laser does two things. It vaporizes tissue. We've talked about it before. The way the laser works is you see the little glass fiber there? That glass fiber delivers to the end of the glass fiber laser energy. The laser energy is produced by a machine here in the operating room. And that machine produces, it's a medical laser, it's a holmium YAG laser, okay? And it's designed specifically for these types of applications, spine, prostates, kidneys, you know, urology, orthopedic, spine, and other types like OB-GYN procedures. So the laser is FDA approved. Everything we do is FDA approved. And the laser really is the best way to look at how it just chops off bone spurs, you know, in seconds. If we were trying to remove those bone spurs with any other surgery technique, that's a herniation there. It would literally, moving my tip too much. Any other type of technique, such as a drill, would be far more dangerous. The laser does it precisely. The precision is 0.5 millimeter of precision. Okay? 0.5 millimeter. There's no tool that's more precise than a laser. That's why lasers are used. I don't know if you guys know this, but the smallest particles made in the world in physics, they're controlled by laser beams. You guys know that? Laser beams are used to harness the energy of the sun in these fusion reactors. And they use the lasers to precisely control these tiny particles. So lasers are the most precise tools we have in science. There's nothing more precise. And you hear this talk about spine surgeons talking about, there's a herniation right there. Look at it. Getting ready to get out of there. It's like, hey, my bags are packed. Look how smooth it is. That's from all the inflammation over the years. Just trying to attack it. Her body trying to attack it and get rid of it. And look how big it is. It's probably 2 millimeters wide and about 4 millimeters long. Trying to get it out, but I don't think I did. When we get bigger herniations like that, we have to usually cut them in pieces with the laser. But we'll see, yeah. Still there, I think. I'm going to have to work on that a little bit more. Well, you got herniations coming out of the woodworks now. Look at that. So I'm cutting it in half. Look at it trying to hide. You ain't hiding. I'll go work on your family members on the other side over here. It's like cleaning out the rat's den, you know? Get rid of these little rats in here. You like that, Luis? The rat's den? Oh, there's one right there. Look at them all hiding down here like cockroaches or rats, causing problems for this patient all these years. So the reason they're smooth, again, these pieces of herniation elicit, provoke, stimulate, create, whatever word you want to use. They cause to happen inflammation. And that inflammation is her body attacking them, trying to get rid of them, just like I'm doing right now. I'm helping her body get rid of these herniations and the bone spurs. Now, we don't need to get rid of every bone spur. Oh, look at that. Oh, yes, bring yourself to me. Let me ease your suffering. The herniation, in a way, is like, hey, her inflammatory system has been attacking and persecuting me for all these years, right? And now you're going to release me. Thank you. So I'm actually doing everybody a favor. I'm doing her inflammatory system a favor by getting rid of the noxious stimuli causing it to be inflamed. I'm giving her herniations, doing them a favor, right? Because they're not going to be attacked anymore. They're going to find peace in the bottom of a petri dish. And then I'm doing her bones a favor because her bones are like, God, look how all the bone spurs that have been developed by her bones, you know, trying to like block off the inflammation so it doesn't affect them. Somebody called me the other day. They said, you're a painkiller, Dr. Deuk. But you know what I really am? Henry, you're going to like this. I'm a peacemaker. That's really what I am, a peacemaker. Yeah, I'm a painkiller too. You make peace, you get rid of the pain and suffering, right? Sometimes I wonder if I'm just talking to myself.
No, I understand. It's, I'm just engaging,
I know.
listening. Yeah.
That's why I pay all these people in the operating room to be here so they can listen to me. I don't really need them, right, Luis?
Yeah, I'm a good
I just need you guys to listen to my jokes. I'm just kidding, of course. They make my job 1,000 times easier. But we gotta have some fun, you know. We gotta have a little bit of fun. Otherwise, I don't know. It might get too boring. Doing the same thing over and over again. These are bone spurs, by the way. The gold stuff here is bone spurs off the end plates. That's off of C7. This is the C6-7 disc, and these are all pieces of herniation and scar tissue back here. You can see the posterior annulus fibrosis right there and the spinal cord down there. And I'm just cleaning all this junk out of here. All right, any questions?
No current questions, but we do have comments from Canes25 on YouTube.
Oh, Games 25.
And
You
they
like that.
and they said, "Good morning to the best team in the world and the smartest doctor in the world.
Oh, thank you.
Maybe a good time for Grabzilla."
Crabzilla, I love it. Thank you, Gaines25, for joining us. As always, we enjoy your insightful comments. We can't use Grabzilla on the cervical spine. I'm sure you know that. Grabzilla, for those of you who are the uninitiated, is actually a metal grabber that we bring out when we have large pieces of herniation in the lumbar spine and maybe sometimes the thoracic, but you can't use it in the cervical. It won't fit down the cervical scope. That said, I appreciate the sentiment, and these pieces, you know, Grabzilla is 7 millimeters almost wide, and this tube is, in the inside, it's 2.5 millimeters. So that would be like trying to fit a 1 pound salami in a 1/4 pound bag. All right, just about done with this disc. By the way, and the other surgeons that wanted to do her surgery, they wanted to fuse her, and she didn't want it. She didn't want a metal plate. She didn't want trouble with her voice. She didn't want complications of fusions, adjacent segment disease, and go into pain management after, and narcotics. She wanted to be fixed the right way. She found us, and she knew this was it. She's a musician by trade. She's with her husband here, and they're lovely people. I found her on telemedicine. She found us on the internet. We did a telemedicine consult, and, you know, she came to Deuk Spine, and here she is getting her surgery. Oh, I think she's going to be very happy with the results. Man, Luis, you're using the new tube, huh?
Yeah.
It's amazing, huh?
They're good.
All right, keep your questions or comments coming. This is the foramen, by the way, the neural foramen. And that's a bone spur. And there's a little bit of ligamentous hypertrophy just below it. And of course, the nerve root sits out there. So we've already taken out some herniations out of this foramen, which I'm happy about. You can actually see a little bit more movement at this disc space. Remember when we first went in, just rewind your video and you'll see when we first went in here, we couldn't get any movement at all, right? Now we're getting about 2 degrees of movement. Now the normal movement here would be 4 degrees, but 2 degrees so far is better than 0. So already we've restored movement to this disc. That's something we don't talk much about, but since Gaines25 is here and we talk about everything else, I want to give him or her, I don't even know if Gaines 25 is a male or female or what they identify as. But I want to give Gaines 25 and the rest of the audience some information. So we don't talk much about this, to be honest, but you'll notice when we're done, you can actually see movement of the disc, whereas fusion, obviously, you lose movement, and artificial discs are supposed to preserve movement, but what really happens with artificial discs, a lot of them fuse anyway. So the whole theory of preserving movement at a disc with artificial discs doesn't always work out that way. But with Deuk laser disc repair, 100%, you can see movement of the bones that you didn't see when we started, right? There's another herniation right there. I have to cut that one in half. So you have losing movement surgery, fusion. You have preserving movement surgery, artificial disc. And then, for la piste de résistance, you have movement returning surgery, giving you movement back where you've lost it at this bad disc. And that's the Deuk laser disc repair. The best of the best. Tell me one thing that makes a Deuk laser disc repair worse than fusion or artificial disc. It has a faster recovery time. Deuk laser disc repair is more effective. I have no irrigation. You guys got to be watching that and changing the bags. The Deuk laser disc repair has fewer complications than fusions or artificial discs. You guys know what the complication rate is for artificial discs and fusions? Fusions, ACDF, they say it's 50%, 48% basically. Half the patients have complications. With Deuk laser disc repair, we've had 0 cervical complications. 0 in 16 years. With artificial disc, the complication rate is published around 20%. So which would you rather have? A surgery that gives you a 20 or 50% complication rate, or a surgery that has 0 complications? I know which one I want. Almost done. And then of course recovery. If you're recovering from fusion, you got, a couple of months, maybe 3 to 6 months recovery. With Deuk laser disc repair, it's overnight, 1 day. With fusion, 3 to 6 months. Artificial discs, you're talking about probably 3 to 6 months as well. So only one surgery gives you fast recovery, best results with pain relief, no recovery time basically, and that's the Deuk laser disc repair. Any questions from our audience?
No current questions, but we do have excuse me, a couple comments from Gaines 25, once more on YouTube. And they said, I am male, sir. I am full of testosterone. And this is the safest spine surgery in the world, hands down. I researched all of them for over 20 years. Nothing comes close.
Yeah, you're right. And I've performed them for 20 years, 25, 26 years. Yeah, so people think, oh, Dr. Deuk Machen, Deuk Spine, you guys just promote the Deuk laser disc repair because that's all you do. What they don't understand is we do fusions, artificial discs, we do it all. We promote the Deuk laser disc repair because it's the best of all the surgeries available. These other surgeons, they don't do Deuk laser disc repair, but they do fusions, artificial discs, but we do Deuk laser disc repair and we do fusions and artificial discs. So they have a limited number of treatments in their bag. We have all the treatments in our bag, and this is the one we choose time after time because it's the best. All right, I think we're done here. Yep.
Lights on, please. Stop off. Thank you.
All right, at this point, we finished one of the discs, the harder one, at the bottom, and we're going to put a little betadine, which is basically antiseptic. And the reason we do that is anytime surgeons do surgery, we like to put antiseptic in our irrigation. The irrigation's purpose is to get rid of blood, little pieces of disc material that may have been left behind. It's just to clean out the area so it's nice and clean, because the truth is anything we leave down there is devitalized tissue, meaning, careful, meaning that it's dead tissue, okay? And dead tissue is a place where infection can happen. Watch that. And we don't want infection. So every surgeon I know takes irrigation and cleans out the wound to get rid of any dead tissue that might be in there from the surgery. You know, it'd be kind of cool, Luis,
Yes, sir.
in the new center, if we didn't have to have canisters, but they could just drain directly into
To the wall or
the
something.
wall or something. They have that system.
Yeah, they,
Remind me to talk to them about it.
no problem, yeah.
All right, so step one, take the tube out, shot.
Also, can you pull?
I need some visibility, Dr. Berndes. I need you up here doing your inline traction job. All right, looking good. Shot. Perfect. Coming out. All right. So, shot. And you guys ready? Wait, now, slow down, slow down. 2, 3, 4, 5, 6, 7. Everyone agrees. All right, here we go. Rock and roll. Up and out. Shot. What do they say? Upsy daisy. Good. We're out. Shot. And you got to be able to feel this, by the way. If you want to do this type of surgery as a surgeon, of course, I'm a highly trained neurosurgeon. We're trained to feel with our hands. Let's get an AP. Thanks. Well, we have to learn to feel with our hands, you know, very sensitive. Shot. We can feel little things. Little things most people don't pay attention to. We have to, because you're working in the human body in between different areas that have different textures and different resistances and consistencies. So you as a neurosurgeon, you gotta pay attention to what you're feeling. Shot. Shot. Let's get an AP. I'm not sure why this is stuck, but it looks like there's a little bone spur there. Shot. I'm definitely in the midline, which is good. And now I just need to get up and over this bone spur. You got a little extension?
Yep.
Shot. Yeah, you see the bone spur there? It's kind of trapping me. So here we go, up and over. There we go. Shot. All right. Wow, there must be a herniation up front because I'm on the front of the spine and I'm not touching the bone. Shot. All right, we need a AP. It's got a little spondy, yeah. It's fine. That's not a problem. All right, looks good. I'm going to go a little bit more north. Yep, go lateral. There we go. Shot. I think not. Clearly she has an anterior shot herniation. Jeez, AP. Anterior herniations I'm not concerned about. They don't cause problems for people. Shot. That's perfect. Let's go lateral and we're ready to go in. So I'm going to hammer this through the front of the disc. I could feel it. Shot. Sacrificing my hands for this patient. We do that. Surgeons, unfortunately, we get radiated to help our patients. AP. It's one of the, it's like playing football, right? When you're a football player, you know you're going to get bad knees and hips and shoulders and necks and backs. That's what we call, part of the job, lateral. For surgeons, we have to take the radiation for our patients. And unfortunately, radiation can result in cancer. We put ourselves in harm for our patients. Shot. Disco, disco? Luis is telling me he wants a disco. You're pulsing, right?
Yes, sir.
Shot?
Yes, sir.
Well, we're going to do a little discogram, like we like to do, to stain the degenerated nucleus blue and the tear. Should see a tear. Shot? There it is. Show the tear. There's actually a tear in the front too. You can see it coming out. But show us the tear in the back. Shot, shot, shot. Good. Yeah, so there's a tear in the back, and that's the one we're after, because that's the one causing all of our pain. And we're after the herniation that's there as well. All right, that looks pretty darn good right there. Any questions? For those of you who haven't seen, the whole surgery is done through a 4 millimeter wide tube, external diameter, 2.8 millimeter internal diameter.
Yes, we have a question from Thomas on YouTube.
Yes, Thomas.
They asked, what's that? Was that disc from before the weakest link? Is that why that particular one is herniated?
Is that disc, what is it again?
Was that disc from before the weakest link? Is that why that particular one is was herniated?
That's a great question. Very insightful, Thomas. Why is number 5, 6, and 6, 7 herniated? They are the most common to herniate in people. Number 1, most common, symptomatic herniation is 5, 6. Shot. The second most common is 6, 7. Then 4, 5. Shot. Then 3, 4.
Is that because of the axial loading from the skull weight?
It has everything to do with, shot,
Lateral rotation.
has everything to do with biomechanics.
Flexion is
Shot. Keep an eye on the tip. Are you giving me, you stopped giving me inline. I'm wondering why am I not moving? And there it is, now we're moving again. Shot. Making progress. One more. We should have this. Ready? Shot. That should be it right there. Good job, everyone. All right, this will be our second and last disc we're fixing. So far, everything's going well. You can all see how tiny the hole is, right?
Yes, yes we can.
So, for some reason, number 5, 6 is the most common to be injured and symptomatic. Nobody knows why, but we believe it's the biomechanics. If you think about it, your shoulders and muscles stabilize 7, 1, 1, 2 down the thoracic. You got the rib cage. And then higher up at the top of the skull, you don't really move that area in flexion extension too much. It's more rotation. So I think this is like the most exposed part of the spine to trauma. And also it's the bottom of the cervical spine, so you have all the lifting force from lifting things like boxes and stuff goes straight to your spine. Remember, all the muscles that, your arms are attached to your shoulders are floating. And the only reason your shoulders don't fall off your body is they're attached to your neck, to your spine, right where we're operating. Look at that herniation just came out. So basically what I'm saying is all the things you lift with your hands, they go straight to your neck and your spine, in your neck, through muscle attachments. It's pretty fascinating. It's something that if you don't really pay attention, it's lost to a lot of doctors. They don't know that, They don't realize that your spine is really a place for muscles to attach from your shoulders and arms in your cervical spine. And all that weight and force from your arms, from picking things up, pushing things, your whole life, it just goes straight to your spine, to your discs. Let's flip it. All right, we're going to be done in 10 minutes, doctor. I'm telling my anesthesiologist we're going to be done soon. There's another herniation that floated out. There's another one that floated out. Are you guys seeing all this?
Yes, we are.
All these pieces of herniation just popping out from deep in the depths. All this is scar tissue. Look at the white and yellow. This is from years and years of war. Oh, another herniation just popped out. So those herniations are coming out from an area called the epidural space, which is right up against the spinal cord. That's why she's having weakness, numbness in her hands, these herniations. Okay, you can see the old stuff right here, and then you can see those herniations are newer. There's another one, new, right there. It's about to come. Okay? So those newer herniations mean they happened more recently in her life. Some of this stuff in here at this disc is old. Like this stuff right here where there's a herniation. See it pop out? So a lot of this is like probably 30 years old, 40 years old, but some of it's newer. Pretty damn awesome. Again, other surgeons don't ever see this. This is like going into King Tut's tomb for spine surgeons. They don't even know it exists, and now they do. But back in the day, nobody knew about it. And then just discovering all these treasures that are in here. Seeing this for the first time, the wonder of it. It's like the, astronomers looking through the Hubble telescope and seeing so much that they never thought was possible to see. If you ask spine surgeons what's going on here, they will watch this and they'll say, I have no clue. First of all, if you don't tell them it's spine surgery, they'll not know it's spine surgery. I guarantee you. They'll say, I don't know, some type of shoulder surgery or knee surgery. I guarantee you, take 10 spine surgeons and show them this video without telling them it's the spine. They will tell you this is the shoulder or the knee. Arthroscopic surgery. They have no clue this can be done. They're so far behind in technology. And it's getting worse because Deuk Spine is advancing more and more because we understand the pathological basis of spine disease. And when you understand pathology of disease, you understand the etiology of disease. You understand the physiology and function of disease. You can actually solve the disease. You can cure it. Oh, herniation from the foramen on the left side. That's where all of her arm symptoms were. That piece of herniation was crushing her C6 nerve root. And that's why she was going numb. Here's another one. There's a bunch of them. All these guys, bad boys, like a bad gang that moved into town, starting to create havoc. Right? You all know when there's a gang that moved into town. Because then you start getting robberies and people are getting held up and robbed at night on the street. Stores are getting broken into. So this is the gang that moved into her foramen. Right, Luis? You like that? Jeez, my analogies. Oh, yeah. So we're removing the gang members. We're putting them in prison. Huh? You like that? I haven't made that analogy before. Except I don't give them a chance for recidivism. They're not going to commit that crime again. I'm going to make sure of it. All right. A lot of still some herniation here, and it's stuck down. Look at this. So here's why a lot of people have spine surgery and they still have symptoms, because the surgeon does not get rid of this right here. This is a foraminal herniation, and the surgeon leaves it. And I'll tell you why they leave it, because they can't see it. They can't see this without an endoscope. I would not be able to do this without this endoscope. So if I was using a microscope, you can't see this. It's too small for a microscope. So that makes this surgery truly the very best for fixing these kind of problems. Okay? Endoscopic laser. Just to give you an idea, you see the glass fiber right there? That is 0.5 millimeter. That's smaller than your eye can really see. You can barely see it with your eye. So that means the foramen is about 3 of these. So it's about 1.5 millimeters wide. Okay? All right, so let me look at the other side of the foramen of the disc. Any questions?
No current questions.
All this white stuff is scar tissue from chronic inflammation due to the herniation in the annulus. This is all scar tissue. There is no reason for me to remove it. It will not benefit her in any way. What I want to get rid of is the herniation that's causing the scar tissue, and I'm doing that. But I'm not going to sit here and remove scar tissue, because I'll take some out if it's pinching a nerve, or I'll take some out if it's holding a herniation in place. I can't get rid of the herniation. But I'm not going to just take scar tissue that's not causing any problems. So as a good surgeon, you have to learn, when does it cause problems, when does it not cause problems. Look at that herniation right there. That's a more recent one. That's about 6 months old. Let me grab that. About 3 minutes left. Now, if you have questions, feel free to type them up and I'll answer them for you. Have we played the full complement of videos? Do we do the how does the Deuk laser disc repair work yet?
No, yeah, we only did neck pain.
Let's do that.
Disc herniations are a common cause of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
Just pulling out some more herniation. So, folks, you understand how the Deuk laser disc repair cervical works. Of course, it's different for lumbar and thoracic. With the cervical, we go through the front, we go through your disc, leaving the disc alone, not harming it in any way. And we just go to where the tear is in the back, and we do our laser debridement, our Deuk laser disc repair. Two minute or 1 minute. Hey, how's my irrigation? Good. This is a new herniation. You guys see this? It's not smooth. It's all irregular. You can see the fibers of the nucleus pulposus, so as opposed to those smooth ones. I think 1 minute left. I think we're done. Are you done? We're done. We're done. We're done. I'm very happy with that. We've got a lot of herniation pieces out. You guys saw them all. We're going to do a little bit of antiseptic, betadine. I just want to thank my team again for doing such a great job. Everybody did so well today so far. We do have 2 more surgeries. The next one is a single level, 1 level cervical, I believe. And yeah, I want to plunge in. All right, can you guys see the incision here?
Yes,
Right there?
yes, we do.
Okay. So that's in the front of her neck. We're going to take this out. We'll be done. I'm going to hold pressure because if she has a little vein bleeding, you know, we'll stop it. See? Nothing. You guys see it?
Yes, we do.
Little vein bleeding there, that's all. You can tell vein bleeding from arterial bleeding. Vein bleeding is dark red. Arterial bleeding is bright red. You guys understand why, I'm sure. Oxygenation. Huh? All right, type your questions up for me. I'll come answer them for you, okay? But we're done. We fixed C5-C7, 2 herniated/degenerated discs causing pinched nerves. We call it radiculopathy, left arm. Weakness, numbness, tingling. Great job, everyone. I just want to thank you all again.
Thank you, sir.
And Henry, have the audience type up questions. I'll come answer them. Good morning, I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute, here with one of my patients who traveled from Mississippi.
Yes, sir. Oxford, Mississippi.
Oxford, Mississippi, which I've never been to Oxford, Mississippi, but I'm sure it's a lovely place.
Very nice.
And why did you come to Deuk Spine Institute here in Florida?
I'm having issues with my lower back, shooting a pain all the way down towards my elbow, as well as having a little bit of stumbling while I'm walking within my left leg. And went to other physicians to look at my spine, whatever, and they wanted to do fusion and all kinds of other nonsense that I thought maybe there might be a simpler way, a process of doing things. Did a lot of research and found Dr. Deuk here.
And what do we do for you?
You guys did a C3, I think 3, 4, 4, 5, 5, 6 at the Deuk laser disc repair surgery.
And before surgery, you had neck pain?
Correct.
For how long?
It's been ongoing probably for about 5 years.
And then pain going from your neck into your right shoulder, down your right arm?
Correct, just getting progressively worse. And that's kind of what made me finally to say I got to definitely do something about it.
Here we are less than 24 hours after your surgery, the Deuk laser disc repair. You can see the incision right here, it's 4 millimeters. And do you still have that neck pain and pain in your arm?
No, sir, zero pain.
Gone?
Gone, completely gone.
Cured?
In shock. Results better than I actually anticipated, which is a good thing, right? That's what I'm here for.
Well, I'm not shocked. It's what we expect to see typically, which is good. The procedure works, and that's why we do it. It works better than anything else. Were you offered any other treatments?
Yeah, they wanted me to go look at a, what do they call a spinal deformity doctor.
Uh-huh.
And they possibly looked at like doing rods and pins and,
Yep.
and all that kind of good, the fusion and everything. So it just kind of,
Why didn't you want to do the fusion option?
long time recovery time and just more of a difficult surgery.
Yeah.
Much more difficult surgery. And me working in a house, I still want to have good quality of life in the future.
Yeah. Well, fusions have complications, a lot of complications. Scar tissue, bleeding, and pain. Are you having any pain right now from the surgery?
No, not at all. Just a little stiffness when I turn left to right, but that's par for the course.
Yeah, the stiffness is going to take some time to work out.
Sure.
You've had a bad arthritis in your neck. Your discs were degenerated. You had degenerative disc disease and herniations and bone spur at C3-4, C4-5, C5-6. We went in and fixed all 3. You will need therapy to increase the range of motion. It'll take time and you'll get better. Are you happy with your decision to come to Deuk Spine Institute?
Very happy. I flew all the way down here from Oxford.
Yeah, very good.
So absolutely made the long trip. I fly back Saturday and I feel much better flying on the plane than I did earlier. Just thinking, I'm not on any kind of pain medication, none of the muscle relaxant. There's zero pain, so I feel more comfortable hopping on that plane.
And we did it all through a 4mm incision. You could actually see the incision with the little tube going in to your discs. I moved the tube from one disc to the next, and we went back to the back of the disc where the tear was, and I cleaned the tears up with the laser. So that usually does the trick of getting rid of the neck pain when it comes from a herniated disc. And of course, we unpinched the nerve roots that were going down your arm, so that's why your arm is feeling better as well. I don't expect any of that to come back. You should be pain-free the rest of your life. Just don't re-injure the discs.
Absolutely. I'm definitely glad to get my quality of life back. That's the number one thing.
Anything you want to tell your audience?
Anybody that's dealing with the same issues I have, I definitely recommend to come to the Deuk Institute of laser surgery. It's a wonderful thing.
All right. Well, congratulations.
Thank you so much. I appreciate it. Thank you so much. We will. Yeah. Well, my dad lives in Tampa, so my wife's up there in Oxford taking care of her stuff up there. So worked out good to have my dad here to pick me up and drop me off at the airport tomorrow.
All right. Sounds good. Well, safe travels for you then.
Thank you so much. I sure appreciate it.
My pleasure. Good morning, I'm Dr. Deuk. It's December 9th, 2022, and I have with me one of my patients who traveled from out of state, Texas to be exact.
Yes, sir.
And he is suffering with neck pain, and I'll let him tell you a little bit more about his symptoms, but he had herniated discs in his neck along with degenerated disc. We just repaired those yesterday, less than about 12 hours ago.
Yes, sir. Yes, Doc. Yeah.
You're here now on post-op day 1. It was outpatient. No hospitalization. You stayed at the hotel. You're back this morning, and how do you feel?
I feel great, Doc. I just want to thank you right off the bat for you and your team for basically giving me another lease on life. I mean, the back of my neck, the tops of my shoulders. I had pain all the way down the back of my arm, and my elbow, and then also I had no grip. And today, it's all back. I just, it's just a game changer. His procedures. Because I've had fusions in the past, like 15 years ago, and those fusions, you don't want to do those because they just give you adjacent disc disease, and I have that problem right now on my back, and Dr. Deuk is going to fix it next week, so I'm very looking forward to doing that.
We'll be seeing him again next week after his back is fixed, but you broke it up into 2 procedures, and we get people all the time asking us, oh, can I come there and get my neck and my back fixed? Yes, you can. We'll probably do it on separate days. So you got 3 discs repaired yesterday. You can actually see right here in this video footage how small the incision is, tiny. And I was in there endoscopically using a laser to clean out the tear and remove the small herniations. And now here we sent you home an hour after your surgery, and here you are back today. And how much of that pain did we get rid of?
All of it, Doc.
100%.
I mean, 100%. And doctor did. They did surgery on 3 different levels. And through a really small hole.
4 millimeters.
Yes,
4 millimeters. Incredible.
There's no stitches. It's just a Band-Aid.
Yeah.
That's crazy. If you have a fusion for 3-level fusion, I don't know how long that would be, but it's
it's about that long for a 3-level fusion. And then of course you'll have swallowing trouble for months, and then you'll have pain and you'll be on narcotics. Are you on any opioids or narcotics?
No, Doc. Last night I went home and to the hotel, and I just took a Tylenol PM, and that's all the medication I've taken since the surgery.
Yeah. So with the Deuk laser disc repair, you don't have to worry about getting addicted to painkillers because there are no painkillers. Literally a Tylenol, and that's it, because it's so minimally invasive. Far better than ACDF, far better than any other cervical type of surgery. Well, is there anything else you want to tell your fans out there before we wrap this up?
Yeah, I just want to let my parents know and my 10 younger brothers and sisters, if you're watching this, if you have back issues, you need to come see Dr. Deuk, because he is one of the only people in the world that can do this procedure, and it is a game changer, and it's well worth it. At least give him a review. He'll do a free MRI review for you. It's just do your research. Go to his DeukSpine.com, look at his website, and just do your research and give give yourself a chance to do the right thing.
Well, thank you. And yes, now I'm the only one, but someday there will be another one
You hope.
who will be doing these
Yeah.
surgeries,
Yeah.
and probably better than me.
Okay, thanks, Doc. Appreciate
Thank
your
you,
help.
sir.
Yeah.
We'll see you soon.
Yep.
All right, I hope you enjoyed that testimonial of that patient. Sorry for the blurriness of my picture.
We'll get there in a moment, and there we go.
So we've just completed a cervical on the cervical spine, 2 cervical discs, number 5, 6, and 6, 7. This patient had herniated discs that became degenerated discs over time due to the inflammation destroying the disc. Again, you're not going to hear this insight from anywhere else because other doctors don't know about it yet. But you'll hear it here at Deuk Spine. So that tear in the back of her disc years ago with the herniation, it's basically created a cycle of inflammation that never stopped for 20 years. And that's caused the disc at number 6, 7 to be destroyed, completely collapse over time. But that said, it can still rebuild itself and heal into a pain-free, symptom-free state. And that's what we're doing with the surgery. The surgery we do doesn't make this look normal. Again, there's no surgery in the world that does that. If you have an ACDF fusion, that's what you get put in. Your disc is not going to look normal. You've got a cage in there with a metal plate with screws. Your spine will never look normal again. If you get a posterior cervical fusion, you're getting screws and rods put in the back of your spine. Okay? No matter what surgery we do as doctors, there is no making your disc look normal again. It's not possible. The best we can do is making your disc asymptomatic or pain-free. No doctor will do cosmetic spine surgery. Spine surgery is reserved to treat patients who have symptoms from their spine that are fixable with surgery. The procedures you watch today are treatments that cure spine symptoms coming from disc problems. All right, let's get to our first question.
First question comes from either Wizzy or Wisey on YouTube, and they asked, "Hi Duke Spine, is it possible to get a paperwork for a visa application for a national who requires a U.S. visa to travel for this treatment?"
Wow.
Yeah.
Sorry, I'm just trying to figure out how we can help you. So what I would recommend, we don't provide visas, and I'm not sure why you would need a visa to come here, but we do have a lot of patients traveling from other countries, and they don't require visas. I don't think you need a visa for medical care. If you do the MRI review with us, and Henry will type in the address here right in the dialog box. It's mri.deukspine.com, and it's determined that we will benefit you with our laser surgery. Then we will do everything we can to help you get over here for your surgery, including filling out paperwork if that's needed. It's not a problem. I've just never heard of that from anyone before, so it could be that you're correct and you need some type of paperwork filled out, and we're happy to do that for you.
Next question comes from Thomas, once more on YouTube. And they asked, with a well-balanced muscular system, are you less likely to have a herniation?
With a well-balanced muscular system, are you less likely to have a herniation? I think the answer is no, unfortunately. Herniations are traumatic events. The first step in a herniation is always some type of trauma to the spine. Now, it doesn't have to be a major car accident or falling off a roof. When you think about it, what's being damaged is the soft tissue between the bones. They just get ripped. So you need some type of a force, whether it's a car accident, rear-ending, side hit from the side, front-end collision. All of those car accidents cause injuries to your discs. And then, years later, the herniations come through the tear that's from the car accident, and the herniations create inflammation, which then creates symptoms. So car accident is probably the most common cause of disc injuries. But having a muscular system that is, in great shape is not going to protect you from the trauma of getting a disc injury. And it may help a little bit, and then it won't protect you from herniations. Herniations come from lifting things, anything. Could be a normal 20-pound, 30-pound object. Once you have that tear in the wall, the herniations come easily. So really, if you want to prevent herniated discs in your lifetime, avoid all trauma. That doesn't mean go live in a closet somewhere and hide from the world. It means just be really careful and sensible about what you do. In the end, injuries are inevitable. Injuries happen because of accidents. Accidents are many times unavoidable. But try to avoid accidents, try to avoid injuries, and that will give you your best chance of not having a herniated disc. Once you have a herniated disc, the very best thing you can do, it's not therapy, it's not chiropractor, it's not acupuncture or yoga, it's not shots, it's not open surgery. It is literally the Deuk laser disc repair. That's why we do it. It is the very best in the world.
And then next there is a question. This comes from Cindy on YouTube. And they ask, my cervical is fused in 3 places on its own. How would this work out? In thinking the surgery. I've had pain for 20 years since my 40s, and quality of life has diminished.
Hi Cindy, there's only one condition that autofuses your spine, and that's called ankylosing spondylitis. And if you're having pain from autofusing, the pain is probably happening from inflammation within your facet joints. Those are something we can treat. We can deaden the facet joint nerves with the Deuk plasma rhizotomy. My advice to you is do the free MRI review at Deuk Spine and let us look at your studies, your MRI, your X-ray, your CAT scan, figure out where your pain's coming from through our Zoom link and our meeting, and then we'll give you our advice on getting rid of your pain. But yes, we can get rid of pain even with autofusion. It's not coming from the fused segments. The pain is always coming from the adjacent segments next to the fusion.
And that is it.
I hope you enjoyed the surgery. It went very well. We had a lot of herniations, a lot of bone spurs. The laser took on a big challenge today, cleaning out the bad gangs that were causing her symptoms. She's going to be leaving to go home in about 30 minutes. So the recovery for all these surgeries is about an hour, and the patients always go home the same day. This is outpatient surgery, folks. No hospitalization. It's in and out quick. A lot of our patients fly in. They're here for 3 days and they fly home, wherever they're flying. About 80% of our surgeries are now from out-of-staters who fly here. Hope you have a great day. We'll be back in 45 minutes for a 1-level Deuk laser disc repair, cervical. This patient has a herniated disc at C5-C7. He is from Boston, Massachusetts. He's flown to Deuk Spine Institute here in Florida to have the Deuk laser disc repair. And we're going in on the right side because he has left arm weakness, numbness, radiculopathy. If you look at his MRI, he has a big herniation. So we're going to get a lot of pieces out of there. All right, should be